Hey, everybody, this is Nurse Eunice, and I hope that you are having a fantastic weekend. And so today is Saturday, December the 6th, and we are going to have a 25-question practice examination to help you prepare for your CNA examination. And as we do in each of our videos, we're going to give you a few moments to receive your notifications, and we will get started shortly. So, hey, everybody. So, welcome to your CNA practice test. This practice test is designed to simulate the real exam experience and help you prepare effectively. In this video, you're going to be able to test your knowledge across multiple CNA exam topics, understand the rationale behind each answer, build confidence for your certification exam, and identify areas that need more study. Think about your answer before the correct answer is revealed. And if at any time you need to pause the video, go ahead and do so, and you can always re-watch it. I am so excited, you all. We have so many students who have purchased our new CNA exam prep study guide. It is available on YouTube. It's also available on Amazon. And if you take your phone, open up your camera app, and you scan the QR code that is on the screen, you will be able to be directed to our Amazon store. We have so many students, especially our students in-house, who've already purchased the book. And so if you need help passing your examination, this includes written exam prep. It has medical terminology, practice test questions, also abbreviations. It also has the steps for your clinical skills. And so I tried to make a one-stop resource to help you pass your examination. Plus, it's easy to read. So it's not as complicated as some of the other textbooks like those you see at a college setting. And so I hope that you purchase it and I hope that you enjoy it. And let's get started with our review. Hey, everybody, I see you coming in. Let's get started now. All right, so question 1. A resident tells you, I don't want to take a shower today. What should you do first? A, tell the resident they must shower because it's on the care plan. B, report the refusal to the nurse immediately. C, ask the resident why they don't want to shower and offer alternatives. Or D, skip the shower and document that the resident has refused. And now I'll give you about 3 seconds to come up with your answers. So revealing the correct response in 3, 2, and that is right. If you chose C, you have it. You're going to ask the resident the reason that they don't want to shower and then offer alternatives. And here's the rationale. The CNA must first try to understand the resident's concerns and offer alternatives, such as maybe a bed bath or showering later in the day. This respects the resident's right to refuse while attempting to provide care. All right, great job if you answered that one correctly. Question number 2. Which of the following is the most important reason for a CNA to wash your hands before and after providing care? A, to prevent the spread of infection between residents. B, to comply with facility policy. C, to protect the CNA from getting sick. D, to make the resident feel more comfortable. All right, and we're torn on this one. We're torn between A's and B's. So we'll give you a few more seconds to enter your response. And that's right, the A's have it. It is to prevent the spread of infection between residents, the rationale. The most important reason for hand washing is to prevent the spread of infection from one resident to another, cross-contamination. That is the foundation of infection control. And here's an additional note. While protecting yourself and complying with policies are important, preventing the spread of infection to vulnerable residents is the primary goal. Question 3, medical terminology. A resident's care plan states that they need assistance with ambulation. What does this mean? Is it A, the resident needs help with bathing? B, the resident needs help with toileting? C, the resident needs help with eating, or D, the resident needs help with walking. All right. Fingers crossed. I hope you're going to answer this one correctly. And if not, you're going to make a mental note, have your pen and paper available so that you understand what the term ambulation means. And if you said D, walking, you got it right. So ambulation means walking or moving from place to place. This is a common term that CNAs must understand. And so some other terms that you need to remember would be ADLs, which stands for activities of daily living, and mobility, which means the ability to move. So when we ask, is your patient mobile? And sometimes you'll respond, well, they're mobile with assistance, they're mobile with a cane. All of that's important because it helps us know how this patient moves from place to place or location to location. Question number 4. Which of the following is considered a normal range for an adult's oral temperature? Is it A, 96 degrees Fahrenheit to 98 degrees Fahrenheit? Is it B, 96.6 degrees Fahrenheit to 98.6 degrees Fahrenheit? C, 98.6 degrees Fahrenheit to 100.6 degrees Fahrenheit? Or D, 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit? Oh, this one's tricky. I'm torn between two answers. I know. Nope, it's not A. I know you want it to be A. 96 degrees Fahrenheit is just way too low. So for those of you all who chose D, you have it. And so the way that I like to remember it is because I want to try to simplify your life. 97s to 99s. And so, yes, we said 97.6 to 99.6, but 97 degrees Fahrenheit to 99 degrees Fahrenheit, those are our normal ranges. Yes, 97.6 is on the lower end, but technically, according to textbook, it's still normal. Now, if your patient's voicing concerns, if they're saying, I'm feeling cold, well, that would be a problem. But the normal adult range is 97.6 to 99.6, or you can simplify it the way that Eunice just did it, 97 to 99. However, it varies by individuals, the time of day, the activity. If they just went outside and walked and it was hot outside, where the temperature is going to be higher than 98.6. It could be 99 degrees. And also the measurement method. That's right. So whether you're taking an oral temperature, an axillary temperature, rectal temperature, a thermal temperature, whenever you're scanning the forehead, depending on where you're taking the temperature, the reading could vary. Therefore, we give you a range. I know that the textbook says 98.6 is the correct temperature, but our patients are not textbooks. They're humans. And so humans are allowed to have ranges. So 97.6 to 99.6. Great job, future CNAs. Question number 5. A resident's eating lunch and suddenly grabs their throat and cannot speak or cough. What is the first action a CNA should take? A, offer the resident a glass of water. B, go and find the nurse immediately. C, perform abdominal thrust. Or D, pat the resident on the back. Right. And so if you've not taken CPR and AED, if you've not taken your course, this is something that's usually discussed during your CPR and AED course. We have to show you how to take care of somebody who's having a choking emergency. So whenever someone is grabbing their throat and they cannot speak or cough, you're going to do C. That is right. You're going to perform abdominal thrust, previously referred to as the Heimlich maneuver. Rationale: grabbing the throat is the universal sign of choking. If the resident cannot speak, cough, or breathe, the area is completely blocked, and immediate abdominal thrusts are required to clear the obstruction. Never offer water or pat the resident on the back if they are choking, as this can force the object further down. And remember, right now, our goal is to get the object up and out. So don't hit them in the back. That can make the object go down, and don't give them any water to drink it down. Try to do those abdominal thrusts. And if the person's pregnant or obese, instead of doing abdominal thrust, You would do chest thrust instead. All right, let's go to our next one. I hope you're doing well. That was question 5. We're now on question number 6, promoting independence. Which of the following actions best promotes a resident's independence? A, doing everything for the resident to save time. B, encouraging the resident to do as much as possible for themselves. C, asking a family to perform care tasks. Or D, hiring a private caregiver. Now think of the key term. What is this question talking about? Well, it's talking about the resident's independence. And so if we want to keep somebody independent, that is right. It is B. We're going to encourage the resident to do as much as they can. If they can do it safely, allow them to do it, even if they're doing it slowly. Promoting independence is a core responsibility of the CNA. Even if it takes longer, allowing residents to perform tasks themselves help maintains their dignity, self-esteem, and physical abilities. Here's a quote: do with the resident, not for the resident. Number 7, standard precautions apply to, would it be A, only residents with known infections? B, only residents with HIV or hepatitis? C, all residents regardless of diagnosis or infection status? Or D, only residents in isolation rooms? Standard precautions. What is the standard, the bare minimum in order to keep you and your clients, your residents, safe? That's right. If you chose C, great job. So every resident, regardless of their diagnosis, you're going to practice those standard precautions: hand washing, gloving, donning the appropriate PPE, masking if necessary. So standard precautions must be practiced with every resident in your care, not just those who are known to be infectious. You cannot tell by looking at someone if they have an infectious disease. And then on top of that, you're going to treat all blood and bodily fluids as if they are infectious. Question 8. A resident with dementia is pacing the hallway and asking to go home. The best response by the CNA is to A, tell the resident they are already home. B, gently redirect the resident and walk with them. C, tell the resident they cannot leave. D, give the resident medication to calm down. The resident's pacing. They want to go home. That is right. I knew you all would answer that one correct. Yes, you're going to gently redirect the resident and walk with them. So the answer is B. Here's the rationale. Residents with dementia may have confusion about time and place. Telling them they are already home or that they cannot leave can increase fear, agitation, and pacing. Giving medication is not in the CNA scope of practice, and it's not the first line approach. Gently redirecting the resident and walking with them would help to reduce their anxiety, provide reassurance, and it will help to keep them safe while honoring their feelings. Question 9. Which of the following vital sign measurements is outside the normal range for an adult? Would it be A, a blood pressure of 118/78 millimeters of mercury? Would it be B, a pulse of 82 beats per minute? C, a respiration rate of 24 breaths per minute? Or D, a temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius? That's right. You have to know your vital signs because your job as a CNA would be to notify me, the nurse, if something is outside of the normal parameters. And so you must know what is normal, not just normal for the facility, but normal for that patient. And so that is right. Great job, Katrina. Great job, Michael. It is C. Respiration rate of 24 breaths per minute is outside of the normal range. And so what is the normal range? It is 12 to 20 breaths per minute. So a respiration rate of 24 is higher than normal. It could indicate pain, anxiety, fear, or difficulty breathing, or your patient who has a respiratory concern just walked to the bathroom and came back. So we try not to do vital signs right after a person has had motion. They're moving. You want to do those vital signs before. So the blood pressure was normal, the pulse was normal, and the temperature were all within normal ranges. Whenever you're counting respirations, remember that one inhalation, one breath in, plus one exhalation, one breath out. That will result in one breath. So in, out, one. All right, let's go to number 10, team. Question number 10. Which of the following is the most effective way to prevent pressure injuries or bed sores? Is it A, reposition the resident at least every 2 hours? B, keeping the resident in the same position for 4 hours? C, repositioning the resident at least every shift? Or D, using a donut cushion? Oh, that was too easy for you all. Yes, it is A. Reposition the resident at least every 2 hours. The rationale: pressure injuries are caused by prolonged pressure on the skin, which cuts off blood circulation. Repositioning at least every 2 hours relieves this pressure and allows blood flow to return to the tissue. Important: never massage a red area on the skin. This can damage the tissue further. So we do not massage irritated areas, excoriated areas, or areas that have pressure, because usually it's over a bony surface, a bony prominence, and we don't want to irritate that area further. Question 11. What is the single most important method for preventing the spread of infection? Is it A, wearing gloves at all time? B, proper hand washing or hand hygiene? C, wearing a mask when providing care? D, keeping residents in their rooms? And I see so many of you all in the chat saying that you passed your test. I am so proud of you. I'm so, so proud of you. Thank you all for trusting us as you prepare for your examinations. Our job is to help you pass your exam so that you can get out there and help take care of patients. We need great caregivers like you. Yes, that was easy. The answer is B, hand hygiene. So according to the CDC, and CDC stands for the Center of Disease Control. So according to the CDC and all major health organizations, proper hand hygiene is the single most effective way to prevent the spread of infection. Remember, yes, you can use hand sanitizer, but hand sanitizer doesn't kill all germs. It cannot penetrate the C. diff spores. So you just using hand sanitizer doesn't mean that you're clean. You're literally going to use friction, water, and soap. So the soap should kill the germ or the bacteria. And if it doesn't, the friction should wash it off of your hands, and the water, of course, will run it down the drain. So that is why hand washing is more important than you just using sanitizer. And then here's another note: wearing gloves is important, but it's not a substitute for hand washing. And you're supposed to wash your hands for 20 seconds. So friction for 20 seconds. And then don't forget to clean beneath your nails and around your cuticles. Question 12. When transferring a resident with the weak side, hemiparesis, from the bed to the wheelchair, the CNA should place the wheelchair A, on the resident's weak side, B, directly in front of the resident, C, on the resident's strong side, or D, at the foot of the bed facing away. So half of this person's body is weak, and you have to move them from the bed to the wheelchair. Where are you going to place the wheelchair? Are you going to place it toward the weak side, directly in front of them, on their strong side, or at the foot of the bed facing away? And that's right. We're going to give them as much support as possible. So we're going to put it on the strong side so they can help. When transferring the resident, always lead with their strong side. So yes, the answer is C. Placing a wheelchair on the strong side allows the resident to use their stronger leg and arm to support their weight and pivot during the transfer. And there's another note. Always transfer towards the strong side. 13, and we're going all the way to 25, team. Which of the following is a violation of the resident's right to privacy and HIPAA regulations? Is it A, discussing a resident's care with the nurse in charge? B, closing the door before providing care? C, discussing a resident's care in a public area? D, documenting care provided in the medical record? Which would be a violation? Yeah, you got it. You got it. It was C. Discussing a resident's care in a public area like a cafeteria is definitely a violation. And so you're going to hear so many stories, but I remember that there was a nurse, two nurses actually, and they were discussing a patient on an elevator. And it just so happened to be that the family member was on the elevator. So you have to be careful. Even when you're in the break room, sometimes your voice can travel. So you're not even going to be talking about a resident inside of a break room because a family member could be outside of the break room listening and recording your conversation. So HIPAA law strictly protects the resident's privacy. Discussing medical information or care details in public areas where others might overhear is a serious breach of confidentiality and a violation of the resident's rights. So what happens? You can get fired, you can get sued, you can lose your license. It's not worth it. So only discuss the resident care in private areas with the care team members who need to know. So we discuss information on a need to know basis only. And fortunately for you as a CNA, if there is a family member who's asking a question, you can always defer them to the nurse. And I'm going to then defer them back to the patient if they don't have a security code or permission to get that information. And so we try to protect that patient as much as possible, even with family members and visitors in the hospital or nursing home. 14, what is the normal range for respirations per minute for a healthy adult? Oh, this should be easy. I think we covered this one. Is it A, 12 to 20 breaths per minute, B, 10 to 15 breaths per minute, C, 20 to 30 breaths per minute? I was tired when I did this one. Or D, 20 to 30 breaths per minute. Look, you all know that nurse units be doing the most. Look, we've moved into our new location. I've been training today. I've been trying to do these slides. And so give me grace. This was a freebie for you. That is right. The answer is A. It is 12 to 20 breaths per minute. So the normal respiratory rate for a healthy adult is typically between 12 and 20 breaths per minute. Rates consistently below 12 would be bradypnea, or if it's above 20, that is tachypnea. Anything that is outside of the normal range, you want to be reporting that to the nurse. And then don't forget, whenever you're doing your vital signs, whether that's your respirations or the pulse, you're supposed to count for 1 full minute, especially if the respirations or the pulse would be irregular. So think about somebody who has sleep apnea. You want to be counting the respirations for a full minute. You cannot do 15 seconds and then multiply that number by 4. Question 15. When performing perineal care on a female resident, the CNA should wipe, is it A, from back to front, B, back and forth, C, in a circular motion, or D, from front to back? That is right. You have it. You're not going to contaminate our patients or give them UTIs. That's right. It is D, front to back, from the urethra towards the anus. Wiping from front to back prevents bacteria from the anal area from entering the urethra. That's where the urine comes out at. So that is the single most important step in preventing UTIs, whether you're taking care of a male or a female. You start from the front and then work your way towards the rectum. Always clean, from clean to dirty, front to back. 16. Which of the following is the most common cause of accidents in long-term care facilities? Would it be A, burns, B, improper hand washing, C, poisoning, or D, falls? Read that question twice before you give me an answer. Absolutely, you are correct. No, it's not B. B says improper hand washing. I'm sorry, you all. It's a lot of noise out there. And so, improper hand washing is not the cause of accidents, it would be the cause of infections. So, what would be the cause of an accident in a long term care facility? It's going to be those falls and those fall hazards. So, your job as a CNA would be to prevent your patient from falling. So, the answer is D. Falls are the most common cause of accidents and injury in long-term care facilities. Risk factors include muscle weakness, poor vision, medication side effects, and environmental hazards like wet floors and clutter, or you leaving a call bill across the room, you're not giving them the items they need, the pitcher of waters across the room, and you know those patients, they don't want to call you. They're going to try to get up and get things themselves. So make sure you have everything that is accessible, and on top of that, that you use non-skid socks or make sure that they have non-skid shoes, and that would be how you would prevent a fall. And if you know your patient likes to get up, maybe ask the nurse if we can get a bed alarm. Question number 17. Which of the following is an example of objective data? Is it A, my head hurts, B, I feel nauseous, C, an elevated blood pressure of 150/90, or D, I am very tired? So in order for you to answer this question, you have to know the difference between objective data and subjective data. And on the next slide, you'll find the answer. All right, I see we're torn, but there are more C's. So yes, great job, team. And here's your rationale. Objective data, such as vital signs, are things you can see, also things you could hear, smell, or measure, such as a pulse, a rash, or maybe the patient is vomiting. Meanwhile, subjective data would be symptoms. That would be things that the resident tells you, such as my pain is a 7 out of 10, or I feel nauseous, or I'm dizzy. And so while those cannot be directly observed, you would still report those subjective data, those symptoms to the nurse. Here's a reminder. Objective means observation. Subjective means a statement. Question 18. What does the medical abbreviation NPO stand for? Is it A, no physical output, B, nothing by mouth, C, new patient only, or D, nightly pulse observation? You all are pros with your medical terminology. Yes, and your abbreviations. So the answer is B. NPO means nothing by mouth, or nil per os, which translates to nothing by mouth. This order means that the resident is not allowed to eat or drink anything. This commonly is ordered before a surgery or a medical procedure. As a reminder, you as a CNA, your job would be to remove those water pitchers and any food from the room of patients with an NPO order. Something else I recommend is that you don't go into the room and say, hey, you're NPO. Our patients don't understand this medical jargon. So instead, it'd be something like this. Ms. Lucas, I know your nurse has already spoken to you. It's time for me to take your water pitcher because for your procedure tomorrow, you cannot have anything to eat or drink. Do you see how that sounds versus saying, hey, you're NPO? So try not to use these medical abbreviations and jargon with your patients because they may not have attended medical school, nursing school, or a CNA school. And you want to speak so that they can understand you. Question 19. When dressing a resident who has a weak side, hemiparesis, which arm, so last time we talked about transfers, this time it's about which arm should be placed inside of the sleeve of the shirt first? Would it be A, the strong arm, B, whichever arm is closest, C, the weak arm, or D, the dominant arm? So your patient has a weak side. Which arm should be placed into the sleeve of the shirt first? Does it even matter? Yes, it matters. We're going to dress the weak arm first. The answer is C. So why dress the weak arm first? Because you can support that affected weak arm. You can help guide it into the sleeve of the shirt or the jacket. This prevents from overstretching or injuring the weak arm. Remember the acronym POW, put on weak. So whenever you're dressing someone, you start dressing by placing the garment on the weak side first, okay? Question 20. Where should the call light be placed when a CNA leaves a resident's room? Is it A, on the bedside table, B, within a resident's reach, C, near the door, or D, at the foot of the bed? Where should the call light be placed? And I know if you've been hanging around me long enough, you're like, Nurse Eunice would say put it in their hand, but that wasn't one of the options. So instead, we're going to put it within reach. It's going to be B. So place it within the resident's reach at all times. So the call light is the resident's primary way to request assistance. Placing it within reach allows them to feel for it, to call for help instead of trying to get up out of the bed on their own. Doing so significantly reduces the risk of falls. And now I want you to think about that same patient who had hemiparesis. One side of their body is weak. Now, where do you place the call bell? Is it within reach on the weak side or within reach on their strong side? So keep things like that in mind. If they have a sling or if they have an affected extremity, the call bell should be on the side that they can move. Okay, so one more thing I want you to do is I always want you to make sure that you actually check the call light. Whenever you're welcoming your resident into the room, I want you to go ahead and press the button, show them how it works, and let them know that someone comes overhead. Ask them, how can they assist? That is going to make that patient or that resident feel more assured. And it'll also mean that they'll be more likely to use it because you actually showed them how to do so. We're almost done, team. Question 21. Which of the following actions best protects a resident's right to privacy during a bath? Is it A, closing the door and pulling the privacy curtain? B, asking visitors to stand in the hallway? C, covering the resident with a bath blanket and exposing only the body part being washed? Or D, all of the above? You have it. It is D. So residents have a legal right to privacy. Always close the door and pull the privacy curtain completely before beginning any care procedure, and then only expose the areas being washed. So if you're giving someone a partial bed bath, let's say that they urinated on themselves, they don't need to be totally naked. You're only going to expose the areas that are being cleaned. And then also ask the family members to step out. Okay, that is going to help protect the resident's dignity, and it complies with HIPAA and also the resident's rights. Privacy is a critical step in every skill. Question 22. A resident drinks 4 ounces of juice and 6 ounces of water. How many milliliters, mLs of fluid did the resident consume? Note, 1 ounce equals 30 mLs. So let's add up those ounces. 4 ounces plus 6 ounces equals how many ounces? And then we said that there is a 1:30 ratio because 1 ounce equals 30 mLs. All right, Nurse Eunice isn't going to help you anymore because I know that you have the answer. And we will reveal it in 3, 2, and 1. And if you chose the answer, hey, great job. Yes, so it's not a lot of conversions that you have to do as a CNA, but you have to know how to convert ounces to mLs and then vice versa, mLs to ounces. Why is that important? Because whenever we're documenting intake and output, we're using the smallest metric units, which will be cc's, cubic centimeters, or mLs, milliliters. So we're never going to tell a doctor, hey, they had 16 ounces of urine output. Instead, it would be the 16 times 30. They had 480 mLs. As you do this more, it's going to be like, oh, that was easy. But for right now, we just need you to know a 1:30 ratio. So to convert ounces to milliliters, you're going to multiply the number of ounces. And so our total number of ounces were 10 ounces. we'd multiply that number by 30. And so that's how we came up with the answer of 300 mLs. In most of your facilities, mLs and cc's are interchangeable. You can use either or. And so why is that important? Because we have to make sure they're not retaining fluid, that they don't have more going in than coming out. And so every 24 hours, we do a balance. We call that our I's and our O's. Your doctors will do a chart check every 24 hours. It's going to tell us if our patient is dehydrated, if they're overhydrated. So the numbers that you write down are super important. Accurate recording of intake and output is vital for monitoring hydration status. Question 23. When using a transfer belt, aka a gait belt, the CNA should place it A, under the resident's clothing, B, wherever the patient wants, C, loosely around the chest, or D, over the resident's clothing. That is right. It is D. You're going to place it over the resident's clothing around their waist. Why? Because that's going to help prevent skin irritation. Remember, their gowns are sometimes open in the back. So we're not going to put this abrasive belt directly onto anyone's skin. And also, it should be snug enough that only 2 fingers can fit between the belt and the resident's body. And it must be placed around the waist, not the chest. So over clothes and then snug. 2 fingers, and make sure it's at their waist level, not up towards their breast. Question 24. Why is foot care particularly important for residents with diabetes? A, they have increased sensation and are more sensitive to pain. B, they have poor circulation and reduced sensation, thus increasing risk of infection. C, their toenails grow faster than non-diabetic residents. Or D, they are more prone to fungal infections only. Everyone has it right. Great job. It is B. Your diabetic patients have poor circulation, and they also have reduced sensation. In other words, if they hurt themselves, they won't feel it. Thus, it increased the risk of injury and the risk of infection. So here's the rationale. Diabetes causes poor circulation and nerve damage, neuropathy, which reduces sensation in the feet. A resident may not feel a small sore or a cut, which can quickly become infected and lead to gangrene or amputation due to poor healing. That is why we need you to inspect the diabetic patient feet daily for any signs of injury. Question 25. Which position involves the resident lying on their back with the head of the bed elevated 45 to 65 degrees? Is it A, the supine position, B, the prone position, C, the lateral position, or D, Fowler's position? Can you see him? You see Mr. Lucas right there? Mr. Lucas is at about 45 degrees. And so what position would that be? Supine, prone, lateral, or Fowler's? That is right, you all. That would be semi-Fowler. So the answer is D. So it's still referred to as Fowler's, but it would be semi-Fowler's, and you're absolutely correct. And look, you all, we have our clinical skills videos, and they have helped so many people from around the world. So if you need help with the skills, look, we have multiple questions. We have practice tests. We even have our CNA exam prep study guide, our workbook. But if you need to see those skills, you need to see them performed, and you need more information, I need for you to scan the QR code or just go to our playlist on YouTube so that you can watch our full CNA skills video. It shows all 22 skills. There is no reason for you to fail the CNA test. I'm going to repeat that. There is no reason for you to fail the CNA test. Look, we have helped thousands upon thousands of people pass, and I know that you're going to be a success story too. If you have not joined our YouTube community, we're going to ask that you do so. And so if you go to youtube.com/Florida training, you can join our membership. And so for those who have already supported our study buddies, it's $4.99 per month. And so I give you links to videos. I give you links to our download downloadables, such as our practice tests. And so it's just an additional way to show thanks for, for some of the work that we do and for you to partner with us. And so if you're interested, I would love to have you as a study buddy or at Scrubs and Ambition at whatever whatever level you want to join us. I appreciate you all. And so I hope that you have a wonderful day. I have one more video to shoot you all. Thank you for being patient between the move, trying to get everything, situated. It's been a lot on me and my team. So that's why we haven't made a video in about a week, but thank you for your patience. And again, thank you for the emails, the phone calls, the gifts. You all love us so much and we love you right back. So have a wonderful weekend and I will see you in the next video.